So approximately 70% of women, they report difficulty achieving orgasm during intercourse. Yet most of them, they never discuss this with their healthcare provider. I hear this concern almost daily in my practice, and today I'm going to share with you some evidence-based insights about female orgasm that can fundamentally change your understanding of your own body, and you can have sexual wellness. Hi guys, I'm Dr. Peter Aziz. In my practice, I see women every day who struggle with sexual health. They have concerns, they feel uncomfortable discussing with their providers. This is why I'm creating this educational content, to demystify these topics and provide you with accurate evidence-based information. Why? Because sexual health is essential. It's an essential component of overall wellness. And there is no reason to suffer in silence. Understanding how your body works is the first step towards addressing any concerns and optimizing your sexual experience. So the first tip that I want to explain is understanding your anatomy. Number one, the clitoris. The clitoris is actually larger than what you think. Most people think of it as just like this small external structure at the top of the vagina or the vulva. But that's actually just the tip of it, or just the visible tip. The clitoris is actually a more of a complex structure with extensive internal components. The full clitoris includes basically something called the glans, the body, two arms. They extend several inches internally along both sides of the vaginal opening. The entire structure contains approximately 8,000 nerve endings, make it one of the most densely innervated part of the human body. So for a comparison, the penis has about half that number of nerve endings. So why does this matter? Because understanding this anatomy is critical. Explaining why direct clitoral stimulation is essential for the majority of women to achieve orgasm. The research have consistently showed that about only 18 to 30% of women, they reliably achieve orgasm through vaginal penetration alone. So that isn't a dysfunctional, this is a normal anatomy and physiology. The clitoris requires direct and indirect stimulation, and penetrative intercourse doesn't necessarily provide adequate stimulation to this highly sensitive structure. So when you understand that your anatomy is designed this way, you can let go of any unrealistic expectations that focus on what works and what doesn't work. The knowledge alone can be transformative for sexual satisfaction. The second tip that I want to discuss is the connection with pelvic floor. Pelvic floor muscles, they play a crucial role in your sexual function and orgasm. These are some muscles that support your pelvic organs, control urinary and bowel function, and they contract during orgasm. So when these muscles are either too weak or too tight, sexual function can be affected. If the muscles are too weak, sometimes like after childbirth, pelvic floor dysfunction can happen. Also, if the muscles are too tight, you can also have a problem, and that causes pain with penetration, difficulty achieving arousal, and inability to achieve orgasm because the muscles are too tense. One thing that can happen with pelvic floor dysfunction is pelvic floor physical therapy. This can basically help you control the muscles if the muscles are too weak, to make it stronger, or if the muscles are too tight, to help you relax and teach you some stretching and relaxation techniques. Keep in mind, this is very different from your Kegels that you do at home. Working with a specialized pelvic floor therapist works wonders and works a lot better than Kegels. Another thing that I want to explain is basically that the normal female sexual response. It follows a very predictable pattern. It starts with desire, goes to arousal, then plateau, then orgasm, then resolution. The arousal phase in particular requires enough time because during the arousal, the blood flow goes towards the genitals, towards the vagina, towards the clitoris. The vagina becomes lubricated, clitoris becomes engorged with blood. This process takes time, so do not rush into it. Research showed that women usually requires 15 to 20 minutes of stimulation to reach orgasm, and sometimes longer. So a lot of women, they report that they feel pressured to climax quickly or that their partners don't understand their time required. That pressure creates performance anxiety for women, which actually inhibits their psychological and physiological arousal response. Because when you're anxious or distracted, your sympathetic nervous system is activated, your fight or flight response. This shuts down basically your need for arousal and orgasm, making it more difficult. So, what can you do about it? Give yourself time. Give yourself permission to take the time you need. Communicate with your partner about what feels good, what doesn't feel good, how much time you need, what you're trying to do to achieve orgasm. If you're trying to do it in 5 minutes, you're fighting against your own body. Now I want to talk about hormones. They actually matter more than when you realize. Estrogen and sexual function, hormones play a significant role, especially. Estrogen maintains the health of the vaginal tissue. It promotes natural lubrication. It supports the genital blood flow. So when estrogen drops, like when you're approaching menopause, or if you're breastfeeding, or certain medications, you might experience vaginal dryness, pain with intercourse. You might also have decreased in arousal or sex drive. Vaginal estrogen therapy can actually work really, really well for this. It's a local therapy that restores the vaginal tissue without having the side effects of taking hormones systemically in your body. It comes in different forms like creams or tablets and rings, and it's been shown in numerous studies to be safe and effective for improving sexual function. One of the most important things that often get overlooked is the brain-body connection. Your mental state and emotional state directly affects your ability to achieve orgasm. So if you are stressed or anxious or depressed, that distracts your body from relaxing, and it actually releases cortisol and makes changes to your genital blood flow. It decreases lubrication. It inhibits the arousal response. The whole thing of it's all in your head, that's a dismissive sense. These are real physiological effects that happen when you are stressed. So if you have stress about work, you're worried about your body image, or distracted by your to-do list, or you're just depressed in general, your body physically cannot respond the way it would as in a relaxed state. Mindfulness-based intervention have been shown in clinical trials to improve sexual function. This means practicing staying present during sexual activity, focusing on physical sensation rather than the intrusive thoughts, and letting go of performance anxiety. If anxiety or depression are significantly affecting your sexual function, consider speaking with a mental health professional, because sexual dysfunction can be a symptom of underlying mood disorders, and treating the underlying condition often improves sexual satisfaction. However, keep in mind that medications for depression or anxiety can actually affect your libido and your ability to orgasm. So be careful if your doctor is thinking about prescribing you medication to help with depression or anxiety. Lastly, I want to talk to you about when to seek medical evaluation. There are certain red flags that you need to look out for that warrant evaluation by a provider. While certain variations in sexual response can be normal, some things can be kind of alarming, like pain with intercourse. If you're unable to achieve arousal despite adequate stimulation, if you have sudden changes in your sexual function, or if the sexual dysfunction is causing a lot of distress in general. These symptoms can indicate some underlying conditions, hormonal imbalances, neurological issues, or medication side effects. Just remember that sexual dysfunction is a medical issue, and you deserve good medical care for it, so don't be embarrassed to bring it up with your doctor. Providers are trained to discuss these topics professionally and compassionately. If you found this information valuable, please subscribe to my channel, like this video, share it with someone who can also benefit from it. Leave questions in the comments below, and I'll do all of my best to address them. Thanks for watching. I'll see you in the next video. I'm Dr. Peter Aziz.